Your name is?
Delwyn Anderson.
And what are you here for? What are you here for?
To see if I can get some satisfactory results from regarding my Parkinson's.
Yeah, Parkinson's disease. Okay. So let's see. You have some tremor, mostly on both hands, isn't it? Mostly on the right hand. Can you do some coordination like this? Okay, and do this motion. Okay, now the other side. He's not as affected as this other patient that I mentioned. Now do this motion, this coordination. We can see the tremor right now. When his attention is someplace else, the tremor starts to happen. Okay, can you lift your hands up as high as you can? Okay, down. Now let's move your foot like that, the right foot, make a circle. Okay, now the other side. It's kind of the left side is, the right side is the one that's mostly affected, isn't it? Now can you stand up and walk for me, please? Just over there and back. Okay. Actually, in this Parkinson disease rating scale, he's in a number 45, because he's not severely, impaired and affected. So, okay, you can sit down, please. But he's pretty functional. So, in his case, what we want is to try to slow down the affection of the condition, also to improve his arms in terms of the stiffness and the tremor. Okay. And also avoid or postpone any problems in the future. Okay. All right. So that's very good. Anything you want to say?
I guess I was wondering, will it grow cartilage in that joint? Or?
Well, I can do something for that. But this is it's like you had some fracture here in the past that healed not well.
Well, the doctor never said anything about fractures when he had actually the first specialist. He just said it's worn out.
It's worn out like our arthritis. Yeah. You can see the alignment. You can see it like this.
I can easily see that. Yeah.
The alignment is not well.
But I thought maybe the arthritis has done that.
Well, it could be the arthritis, but my guess is that you had like an ancient fracture there. Very good. Thank you very much. Well, this is right after the treatment. How did it go? Survived?
It went fine, yeah.
Did it hurt too much?
Just my lip.
Yeah, that's the tender spot. Okay, so let me just see how coordination with your hands. He was not that bad. It's like that's the good thing. There's gonna be not easy. How's the wrist? I did inject on that area for the pain over there. Let's see what happens with that. Okay. All right. And let's see. Okay, I want you to do the coordination with your left. And this is for a purpose. I want to see how the shaking is on this side. It's kind of not that bad, isn't it? Did you see the shaking over there? It's not as severe. Not as severe as in the other. Can you stand up for a moment, please? Okay. Can you walk, please, for a moment? How's your back, by the way? In terms of the hips.
Back feels fine now.
No pain?
No.
And sit down.
I could, after I walk a mile, I could tell you.
Tell me again?
After I walk a mile, I could maybe tell you first.
Yeah, well, that's good. All right, so let me see. Move your legs. Yeah, make it like a circle. That's pretty okay, isn't it? Now the other side. Very good. How do you find that? Well, that's okay. It was pretty okay also before. In his case in particular, is mostly the shaking in both arms and the arthritis, because we did also some treatment for the arthritis in your back, so I hope that also improves substantially, isn't it? Right now, for the moment, it's okay, but still just a few minutes after we did the treatment there, so it's a little bit numb yet. So it's hard to tell. In a few hours, Then when it's really awake, the area, then you'll find out how the pain is over there.
So in some cases you'll get results quick. In other cases it takes a longer.
Yeah, it takes longer, but the thing is that you're not that affected. Okay, you're not that affected at this point in time. So we're gonna compare you in the way you're gonna be doing in 4 weeks. We're gonna do the Parkinson's rating scale, and we're gonna be comparing your speech, the tremor, the aches and pains, your fatigue, and your movements. You know, everything that's listed in the questionnaire over there. Okay. Are you all right?
Yeah.
Anything else you want to say?
Come back.